Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room. We know you've missed us. We missed you too very much. So anybody that had questions about where we went to, we just gave way for a very important program to be done on the channel. The management of Hope Channel would like to say a big thank you to the Northern Union for what they did this past Sabbath. The contributions and the offerings they gave in support of purchasing the outside broadcast van. They say a very big thank you. We know that we are going to get more donations, we are going to get more contributions and more offerings so that the dream of getting the van becomes a reality. I would like to also thank Cocoa Milk for sponsoring today's program. You know, cocoa milk is a plant-based, dairy-free. It means if you are intolerant to milk that we get from animal sources, you can just take this one and you will not get any issues with your stomach. Babies can take it, grown-ups can take it, the elderly can take it. It's fortified with a lot of vitamins and nutrients, so do well to look out for it when you go to all the shops that are around us, especially the Melcom shops, the Valley View shops, NS Chemist shops, and every shop that you go to, I'm sure you get cocoa milk. We had our last show that we had was on oral health, and we all had a lot of questions. So guess what? Today we are going to continue talking about oral health. I hope from the last time we spoke about brushing our teeth twice a day, flossing, and all the good oral health habits, we've been practicing them. If you've not been practicing them, then, well, should I say shame on you? But today we are going to have another very interesting conversation on oral health. There are different dimensions to oral health that we would learn about today. And back on the show, we have Dr. Aaron Osei-Sibe, who is a dental surgeon, and Dr. Kwabena Amponsa Kodia. I always call him Oman, so I get confused with the Kwabena. You're welcome to the show, doctors.
Thank you.
So we started the conversation on oral health. That was sometime last month. On the World Oral Health Day. You gave us a lot. Please, can you just give us small history? No, not history. Yes, a recap, revision, so that when we take the exams, we will pass.
Okay, so I think last 2 weeks or last 3 weeks,
yes,
right?
It's been 3 weeks.
It's been 3 weeks.
Yeah.
So we started our discussions on World Oral Health. So, I mean, the focus. That there's a day, particular day that's 20th March this year. So, I mean, previous years too, it's been the same day. So it's a day set aside to, I mean, place emphasis on our oral health. Most of the time we don't, we take our oral health for granted, but it's known that the mouth is the gateway of the body. So this day has been set aside, for this year and the previous years to, focus on our oral health and for government, for youth groups, and then, health systems to, take oral health seriously, because oral diseases, brings about burdens to global economics and all that. So we have to pay attention to our oral health, and then that's basically what it's all about.
Okay, Dr. Sibe.
Yes, so our focus now is on attitudinal change.
Okay.
We want to change the attitudes of people concerning their oral health. The oral health personnel are there, their facilities are there, but it is the attitude of the people that prevents them from accessing these facilities. So we want to create awareness and education on the need for us to think carefully about our oral health and to preserve it.
Okay, so as you know, we are going to talk about our teeth, the mouth. If you have any contributions, any questions as the program goes on, you can always send them to us on WhatsApp or through text on 055-968-006 055-968-006. We'll go for a very short break, and when we come back, we'll zoom right into the conversation for today. Do well to stay with us.
All SIM cards in Ghana must be registered again with only the Ghana card. Yes, only the Ghana card.
You will not be able to make voice calls, use mobile money services, internet, and all other services linked to your SIM card if you don't.
To register, dial *404# and follow the prompts. You will be required to send the following details on your Ghana card: Ghana card number, surname, first name, date of birth, and sex.
You will then receive a special code which you will present to your nearest service provider agent or customer care center for your biometric details to be captured. Remember to add your digital address.
Dial *404# on your phone to start registering your SIM card today.
For more information, contact your service provider on 100 or the National Communications Authority on toll-free number 0800 110622. Register your SIM card to stay connected.
Cocoa dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
My understanding about laws is that they are rules and regulations governing our society, yes, or our community.
They are like rules. They are made to regulate human behavior.
Right to freedom, right to life, right to own property. Yeah, that's what I know.
Yes. The Supreme Court. Okay, so Shraj, don't see what you. Yes, my right has been violated. In school, I heard that corporal punishment is now abolished, but my teacher still used to cane us. The highest law in Ghana is the Constitution.
This is difficult. The law on life. I think the law on life.
So which is which? The Constitution or the right to life? Why don't you join me, Anita Delight Dankwa, every Thursday at 6:30 p.m. as we discuss all legal issues from a Christian perspective on Hope Channel, your preferred Christian channel. Hi, I am Efia Sewa, a worker, a wife, a mom, and most importantly, God-fearing woman. Life is all about finding a happy balance between work, friends, and family. Love at home is very important to me. That is why I bring to you an exciting talk show that is engaging and informative with discussions about issues facing today's homes looked at from the Christian's perspective. Join me every Tuesday on Hope Channel right here at 8 p.m. with a panel of experts to help strengthen homes and inspire hope.
We won't defy our family's decision and get married or elope. I need advice. What should I do? Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct at.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible.
Is he giving his properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we will not even go into it.
Real Talk, showing this and every Wednesday at 8 p.m.
Back to the consulting room. If you didn't join us from the beginning, we are talking about oral health again today, and we have two very big dentists here in the consulting room with us. So I once saw on Twitter about some ladies talking about the things they go through when they are pregnant, and one thing that struck me was this lady, I don't know if she's black or white or whatever race she is, but then she said when she got pregnant, she lost all her teeth. It made me very scared. Is it that pregnant women lose their teeth, or what happens with pregnancy that it could affect someone's teeth? Doctor.
Okay, so what happens, you see, when a person is pregnant or a woman is pregnant, there's hormonal changes, okay? So the hormonal changes, when it happens like that, a woman has to really pay attention to her oral health, or to, because the woman there's a high tendency that the person can develop, gum disease, and then, even bad breath, and then other serious oral health problems. So because of the hormonal changes, because we have a lot of hormones, increased levels of some hormones in the system, they tend to develop gum diseases, especially when the person has plaque buildup, or the tartar or the plaque, the leftover food that is left on the teeth. Because when it happens like that, there's inflammation of the gum. So when the woman already has a pre-existing, increased levels of hormones in the blood like that, and then there's also plaque buildup, because when there's hormone, the hormone is increased in the system, the person is already having, bleeding gums and all that, and then when the person also has, plaque buildup, it's like worsening the situation.
Okay.
Yes. So when that thing happens, there's a high tendency that a person can, develop. So that's the genesis of, gum disease, and then, periodontal disease when it gets advanced, as you said. So the periodontal disease is when, the gum disease has worsened, it has progressed. So usually there's pocketing around, the gum, or like this, the spaces there are some spaces around the gum, but when there is a disease, and when there's a gum disease, that spaces increases or it widens. So with time, I mean, the person can lose the teeth. Okay. So that's, I mean, I'm sure that's probably how the whole thing started.
Okay.
Yes. Okay.
So is it just most of the time when we see these textbooks and pictures, we see white people. Is it only white people who are getting these diseases? And is it only adults? Because we hardly see pictures of kids showing bad teeth.
Okay, so I'd like to add something little to what Dr. Mponsa said with regards to the gum disease in pregnancy. So in pregnancy, sometimes because of, as he said, the high levels of the estrogen and the progesterone, the teeth are not cemented in the bone. They are held by fibers. So this high level of hormones weakens the fibers that are holding the teeth. And so they end up loosening it. And then with any little trauma, the pregnant woman can lose the tooth. And then because of the condition, sometimes it becomes difficult for them to maintain proper oral hygiene. So that also contributes to them having gum disease. Now, it's also interesting to note that
so
gum...
we are seeing a picture of someone with some plenty thing in the mouth.
Yes.
Yes, this one. Is this what you mean by... We've been hearing you say plaque.
So that is plaque, and when plaque hardens...
It can get like this.
Yes. So once it hardens, it becomes stone-like, and then it's called calculus.
So people have this in their mouth?
Yes. All of us have the potential of developing plaque. But if left unattended for a long time, then it can become very serious. So as I was saying, in the pregnant woman, there's even research that shows that having gum disease can cause premature delivery. So you can have, there's an association between gum disease and then low birth weight and then premature delivery as well. So it's something that's serious. Maybe we could look at the conversation where we could integrate oral health education into antenatal care, so that these pregnant women,
I don't think
women would pay particular attention to their oral health. Another thing that also affects pregnant women is the vomiting. So some people have severe vomiting in the morning, and so this causes acid in the stomach.
When you watch Nigerian films, in the morning they go around from the room.
To go and vomit. Yes. So sometimes in some pregnant women, they really vomit, and the vomit comes from the stomach, and the stomach has a lot of acid in there. So once the acid enters into the mouth, it causes erosion of the outermost layer of the tooth, and this tooth wear can give them sensitivity and can also cause other issues as well. So during that period, once they are having that frequent vomiting, they need to regularly rinse their mouth immediately after such episode of vomiting.
Rinse their mouth with what exactly?
With water. Water is very common. Everyone has water in their house. So you could rinse with a lot of water to dilute out the acid that has come into the mouth to prevent any further condition.
So and then also with the rinsing, you see, as my colleague just said, so, it's also been found out that you see the content of the stomach is, I mean, is acidic. So you don't want to have the damage, I mean, caused on the teeth. To I mean, you cause for you to, or for the person to experience erosion. I mean, the wearing of the wearing away of the outer part of the tooth. So it's also been found out that you can even use baking soda, and you can use a teaspoon of baking soda into a glass of water, and then rinse, because the baking soda is basic, or is alkaline in nature. So when the woman, I mean, at that stage is able to, I mean, rinse the mouth with that, I mean, solution, it will reduce the acidity. So when the baking soda is available to the person, can use that, and then it can really help.
So if you are pregnant, take good care of your teeth. If you are vomiting, if you don't have baking soda, water is there. But
Water
then if you
is
have baking soda, you put a little in some water and you rinse your mouth.
Yes.
I hope nobody suffers loss of teeth. I'm sure the mother of such a the child that comes from that pregnancy, they'll insult you your whole life.
It's very devastating to the mothers. Yes. Sometimes they say, oh, me first born na me see way to me second away so to there's that connotation within our traditional setting, but science has proven the link between tooth loss and then pregnancy.
Okay. So now from pregnancy to child, we see some children, their teeth, their front parts, and sometimes you see them with black patches on their tooth, and they'll tell you, oh, it's okay, the person is a child. Is it okay for children to have such teeth?
Okay, so I will basically start with from the beginning. I mean, as a baby. Okay, so for it's not normal for a child to have discolored tooth. So if there's discoloration, it means that there's something wrong. Because I mean, the tooth is supposed to be, even for the baby tooth, is supposed to be even more, supposed to be whiter than the adult. The adult tooth is a bit off-white. Okay. So if a baby or I mean a child has a tooth that is discolored, and then it means that there's a problem. So usually, what we usually see in our clinic is what we call hypoplesia or enamel hypoplesia. And then one common cause of that is, I mean, women ingesting or taking in tetracycline during, I mean, for now, because there's been education on that. I mean, I'm sure a lot of, I mean, clinicians know that now, and then they are not supposed to do that. So tetracycline can cause staining, even though they can be, the staining or the discolored, I mean, tooth can be as a result of a genetic, I mean, factor too. But I mean, sometimes too is also due to, I mean, taking some of these drugs. So when you are pregnant, you have to be very cautious of what you put in, so that you don't, I mean, affect because when you get pregnant from the 3rd month, that's when the tooth start developing. I mean, yes, that's when
it starts. When it doesn't start when you come out and you see the tooth coming out.
When we come out, by then the tooth has already been formed. So by then we are just waiting for it to, I mean, erupt for us to all see.
Please erupt.
I mean, for come out. Yes. For us to all see. But from the 3rd month, that's when, so we have to be very careful. So as a mother, you have to take
even before you feel your baby kicking.
Taking the balanced diet. I mean, make sure that you take, I mean, food that, I mean, if you are able to drink milk, cheese, and in these other balanced diets, and then do to stay away from when a person is pregnant, the mother or, I mean, the person is more drawn to sweet foods, and then I mean, there's these, I mean, craving for some. So we have to also try and then get these things so that you can avoid such, I mean, discomfort, such unpleasant situations. That's I mean,
okay. And then the little I would like to add is that so sometimes those black stains and broken tooth that we see on the children are as a result of caries. So children too can have cavities or what you know as caca, and the causes are many. Sometimes for toddlers, because they like crying, some parents tend to give them feeding bottle with porridge or Milo or something and leave them with the feeding bottle overnight to sleep with. Now, one of the factors that causes cavities are the glucose diet and the time in which the tooth has contact with the glucose diet. So once the baby goes to bed with the glucose diet, the tooth has a long contact time with the glucose, giving them the preempting them into the dental caries pathway. So they end up developing cavities. So we often advise that as soon as you see teeth developing, even before the teeth come, start developing some oral hygiene practices with your children. So probably whilst they are taking milk, you could put your towel with some glycerin on top and then wipe and massage the gums, because sometimes babies end up having bad breath because of the milk that is stagnant in the mouth. So once the mother is bathing the child and does that, it inculcates a certain habit into the toddler right from the onset that there's something called tooth cleaning or mouth cleaning. And then once they are
toddlers where they can try to brush on their own, you could give them these dragon shaped or something, some interesting toothbrush for them to play with, and then the mom will try and brush for the child. Otherwise, by the time they develop to about 3 years, once you try brushing for them, they will fight you. And so that's how come we see a lot of these under 2-year-olds and then 3-year-olds coming to our practices with very bad decayed teeth, and it's sad. But these are all preventable. So we need to start oral hygiene practices very early.
Okay, so just to add up to what my brother said, so we have to inculcate that practice to the children as early as possible. So, when the child has no, tooth, you clean with glycerin, as he said. So when the person, from 6 months, when the first tooth, come out, so you can decide to just use a brush with water to clean. Because, the last time we made mention about how fluoride can also, you don't want the child to ingest a lot of fluoride to cause.
You don't want them to eat
the toothpaste, because by then the person might not be able to do that. To control, spitting it out. Yes. So you can just use the brush to just clean it. So when the person gets about, when the person is about 1 year, you can send the person to the child to the clinic and then start, for the dentist to examine and see if there is any problem. And then so the dental care has to start as early as even 1 year, so that we can try and then rule out anything, and then if there's any treatment or any advice or anything, we can let the patients know. So when you also, so by from 2 years and above, you can let them brush, and then you have to supervise them for them to, so maybe when they're about 6 years and above, then maybe on their own they will be able to do it.
Okay. Well,
but interestingly, I've come across some 6-year-olds who do not brush very well. So parents should still keep in mind, occasionally they should look into their children's mouth, whether they are 6 years or 2 years, and check whether the brushing is adequate.
Some of us, when we were in primary school, when you go for assembly, smile, bring your fingernails.
They used to inspect all of those things, so I guess it inculcated that attitude. But now I don't. Yeah, so now I don't know whether those practices are still there. I know someone whose mom used to catch him in the morning to brush it, and now he has very good teeth.
Okay, so there's this thing that has come. I don't know if it's a craze or it's a fad. I don't know the word to give to it, but then you see adverts of it all over on social media, when you go on the internet. Tooth whitening. What is it, and why? There are some people that say it's not good, and there are some people, yes, we see some of these dentists showing pictures of people doing. So if it is not good, why are they doing it? If it is good, then tell us so that we can all go and have white teeth.
Okay, so I'd like to start on this one. The natural adult tooth is not white. It's creamish, it's off-white, it could be yellow. Those are the natural colors.
Yellow?
Yes, it could be yellow.
Do you know yellow?
Depending.
Yellow.
Okay, my colors are not. It could be creamish white. But now people are becoming more conscious about their aesthetics, their appearance, because a lot of times when you're talking to someone, one of the first things you notice is their teeth. So people want to have whiter teeth. So yes, dentistry has evolved to the extent where we can help someone who is not so happy with regards to the shade of white of their tooth to change it from the color that they find undesirable to a more desirable color, which may be whiter than what they currently have. And then we have chemical agents which do this and are able to change the shade. But it's not a permanent thing. So once you do it, you may need to retouch on it in about 6 months' time or a year time, because once you're having your nice contomere with palm oil, palm nut soup and all that, you are accumulating different shades of stain on your tooth. And so you'd revert
even with brushing twice.
Even with brushing. So if you are taking Coca-Cola, a lot of Coca-Cola, Fanta, all these are contain pigments. So the pigments are minutely staining the teeth. So over time, the shade of white that you've achieved from your whitening might be lost. But one thing I would want to quickly add is that the agent is a chemical and it needs to be controlled very well. So I advise that anyone who really wants to have whitening done should make sure it's done by a dentist, because a dentist has studied the entire medicine and the knowledge about the entire body and knows how these chemicals can react to the body and knows how to intervene quickly if things don't go according to plan. So I think it's best, if we want to have whitening done.
So we shouldn't buy these ones that they sell in the churches and they come to the marketplaces to sell to us.
Yeah, sometimes these things that we see in our Troskis and on the marketplaces, they are very suspicious. I think a research work was done some time ago by some public health dentists, and they found out that some of these mouthwashes that we see at the lorry stations beside the road, they were not good at all. They contain harmful chemicals. So if ever you want to purchase any product, just talk to your oral health practitioner and let them give you any recommendation.
Okay, so to add up, see the whitening, we have two forms of it. We have the in-office and then the home whitening. So the whitening is quite a borrowed term. It doesn't really, whitening is from the FDI definition or the World Dental definition. Whitening is just, I mean, is a restoration. Like you have a tooth that is, I mean, stained or something, and then you want to restore it, or you want to bring it back to where it is. And then, but so the technical term is bleaching. Okay. So the bleaching is, but we don't want to use the term
so
bleaching.
It's not just our skin that we bleach.
Yes. So we don't want to scare people by saying bleaching, because when you say bleaching, then it means that, I mean,
it's a bad thing.
Yes, it's a bad, but it's something that can be done, and then by a regulated dentist, a person who knows, because what, I mean, we use chemicals, or I mean agents to do that, and it's in the form of, they are acids. We have phosphoric acid usually that is used. So the one that we use at the office, at the dentist, at the dental office, where the dentist supervises, is contains a high amount of this, and then the one that is sent to the house, because you are not really under supervision, we want to use amount of the acid that is low, so that we can. So some of these products that may be seen in the market, even though some of them are not really regulated, they have a minimum amount of. So if you want to really have a whiter tooth, you have to do it severally. You have to do it several times. Give yourself time. But if you want to get it quickly done, then you see a dentist who is qualified. And then they can, under his supervision, you can do this thing, and then it can be safe. You wouldn't have any complications like sensitivity, or even if there is complication, the person knows how to handle it. So the person will tell you that you've developed complications, so go and see someone else for him to manage. So it has to be somebody who actually knows, so that if there's something, if something goes wrong, then he can help you out.
But previously, whitening didn't have a very good name because of the sensitivity that was associated with it. So what happens is that the agent which contains peroxide, there are high levels of peroxide. They penetrate the outermost layer into the second layer of the tooth. And once it gets there, it bleaches, as Dr. Amponza said, it bleaches the shade of the dentine. So sometimes it gives you sensitivity. So for the dentist, if they realize that probably you are prone to sensitivity, they wouldn't do the whitening for you. Or they would do it in a controlled manner, so that they wouldn't do more than you can tolerate, because we are not after the money. Even though it's a service that you are coming for, we also need to make sure that the side effects are ones that are very minimal to the patient.
Another thing on social media, rich kid starter pack. You have glasses. I think all of you are rich kids. You have glasses with something
braces,
on, yes, braces,
and then your inhaler.
Yes. So since we have dentists here, braces. What are they? What are they used for? When can just anybody come and get braces? If you can educate us more on braces.
Okay, so for braces, as we all know, it's not really for fashion, or it doesn't It's not for people who are, who want to show off. So it's something that is, done. It's a procedure done by the dentist to, to restore the tooth to where it's supposed to be, or if there is any misarrangement or malalignment of teeth, then we do the braces. So it's not really for fashion or even though at a point in time people thought that rich people do that, but it has a purpose.
That's expensive. That's why they think rich people do
probably it. That's the reason why. So braces are used for malalignment or misarrangement of teeth. So people, you may have a kid who has the teeth are not properly aligned. You may see, first of all, some of the people some of the patients that we see, you may have the teeth, you call it crowding. You see that it's packed together, it's close together, and then some of them too, you realize that the person has a baby tooth and an adult tooth there, and then sometimes too you realize that the tooth is too big. And then for the jaw is too small to accommodate the teeth. So when the baby tooth or when the baby teeth go away and then the adult ones comes, you realize that the space left is so minimal, and then that affects how the tooth is arranged. So when we see that, we go in and then the braces, that's a very good job. But even before we see, the emphasis has always been on early management. Prevention. So it's prevention and early management, because you don't want, as it takes or as it prolongs, then it means that you are going to spend more. People always complain about dentistry being expensive, but I'm sure that if we detect these things early, it is going to help. Because if you have a child and then you send the child to the clinic early, or you pay attention to your oral health, I'm sure when it's picked up early, we can do, when we see this early in children, because children have, their jaw, their bones are not as dense as, the adults. So when we pick these things, for the children, we may not even put on braces for them, but we have something called removable appliances, or something that, instead of the braces, there's a removable prosthesis that, we can give for the child, to correct it, and then that one is it's less expensive. Even though some of them, even with the removable appliance, will end up with getting braces, but some of them too, or most of them, when they are detected early and then managed, we are able to correct these misarrangements, and then the person will grow up with nicely arranged teeth, and then it will help the person function better.
So
yes.
we have comments from Jones Enchi. He's a public health officer. He says hello to you, Dr. Aaron. He said you were his schoolmates back in SHS BM 412.
Oh, okay.
And he's happy that you are delivering such a nice topic on oral health. He also says oral health or diseases is a condition of public health concern in our society, and that we need to be proactive measures to reduce the incidence, especially among children. Thank you very much, panel, for the sensitization on oral health. So BM412 says thank you to
that's a good one.
Especially Dr. Aaron.
Oh, that's nice. Dr. Mposa is also
you are also last time.
yes.
So something little that I wanted to add to what Dr. Mposa has already said is that usually we have time stamps in childhood development of the teeth. There are particular ages that we look at the teeth of the children, and then there we can intervene early to correct any anomalies before it becomes worse. So naturally, the upper teeth should overlie the lower teeth, and the distance shouldn't be too much. They should come into contact like that. And that's how the natural occlusion should be. But sometimes, maybe due to factors like the jaw being too small, now when the adult teeth are developing, they don't get enough space to develop. So they are all squeezing themselves into that small space, and that causes what we call crowding. Another thing that may occur is some habits that children have might actually cause their teeth to be misarranged. For example, thumb sucking. So for children who Our chronic thumb suckers, from the age of 3, 4 going, if they keep on sucking their thumbs, it will cause something we call an anterior open bite with a proclination. So the upper teeth might be proclined, and once they try to put their teeth together, instead of closing, there will be a space in front there like that, sometimes causing what some people call saber glass. And it's not something that is too pleasant.
So is this the
yes, so this is an example of a 6-year-old with an anterior crossbite. If you look at the tooth over there, as we said, the upper front teeth should overlie the lower front teeth. But I realize that one of the upper front tooth is behind one of the lower, and this is a good time for the child to have presented to the dentist, because it can easily be corrected by what Dr. Mponsa said as an appliance. So it's something that we could give them to wear, and then it will lift up the teeth a little bit and allow the one that is locked behind the smaller one to come out. Because if we don't intervene at that age, so that's the appliance over there, one of the appliances that we use for children who have maybe smaller.
This is not braces.
No, this is not a braces. So for those who have a narrow arch of the upper jaw, if it's very narrow side that is causing crowding, we can actually expand it to allow space such that they could fall into the right place. So as we said, early intervention is always the best. That's why we try to prevent this than to wait till they become adults. And then because of the condition, the arrangement of their teeth, they've lost so much confidence whilst they are children, to the extent that probably as adults they become timid, withdrawn, introverted because of their parents. So it's something that parents should especially look at the age of 6, at the age of 12, at least. At these cardinal ages, children should be seen by the dentist to have any corrections done.
All right, so aside, we've spoken about tooth whitening and braces, and you were mentioning before the show veneers. I don't know if I've mentioned the word correctly.
Yeah, veneers.
Veneers.
So veneers have become a fad now. It's called the Hollywood smile. So for those who want whiter teeth, they could opt in for veneers instead of the standard whitening, because it lasts longer. The effect of the veneers lasts longer than the standard whitening.
So what exactly are they?
So veneers are porcelain materials. So the front surface of the tooth is shaved a little bit, about 0.5 millimeters, and the height is also reduced a little bit. And now the veneer is made in the lab and then cemented on the surface of the tooth.
I've seen videos where they put some paste. Is that the veneer?
So the veneer is a porcelain material, but they put the cement behind the veneer and attach it to the tooth. So it looks like they are putting paste on the tooth, and it actually changes the shape, the size, and the color of the tooth.
It makes it look very...
Yes, so you could end up with the Hollywood smile. So a couple of celebrities in Ghana, I've seen them with veneers, and more people are coming in for veneers. I think for people who are in the limelight a lot more, perhaps if they have very small spaces in between their teeth and they're not too happy with the arrangement or the shape or the size of their tooth, they could go in for veneers, and that would make them look more aesthetic.
It's funny, but then, well, we are being educated.
Yes, so these options are available for those who would want them. Yes, so, and then for braces as well, at a point in time, a phenomenon developed where people said fashion braces. So some of these clinics sprang out where they were putting braces on people without being properly qualified. So as the time is here, we'd also want to advise that whenever you want braces, then make sure the person is a qualified practitioner. In fact, it's not all dentists who can provide braces.
Oh, really?
Yes, it's a specialty. So those who have had training in orthodontics can provide. They know how to arrange the teeth and know how to provide the braces for such individuals for the correction. Now, there are some people who do not want the braces showing.
I can see, and I saw an image on the screen. Someone was having a very, but
okay, so there are people who do not want
the image has come back.
So those that's the veneers. If you look at
the previous
image on the left side, we look at the shade and the size and the color of the tooth. We see that after doing the veneers on the right side,
the face has brightened up.
Yes, now the teeth is whiter. The shape, if you look at the shape, the tooth adjacent the central tooth used to be very small. Now it's relatively larger, and then it's in the correct size and shape. And then there were small gaps. You know, Caucasians do not like to have gaps in between their teeth. Unlike
I know. Some of my people, my friends, they've gone to close
up their gaps. Yes. So unlike some Africans, whom for them having gaps is a sign of beauty. The diastema there is a mark of beauty. Some of these spaces can be closed using these veneers. And then for those who do not want to be seen wearing braces, there are invisible braces available.
Invisible braces?
Yes, so what's called Invisalign. So if you ask your practitioner, probably do they provide Invisalign services? These are clear aligners that are able to close the gaps in between the teeth.
Okay, and I can see somebody trying.
Exactly. So
it's quite clear,
yeah, so it's clear. So once you wear it, nobody would even notice that you are correcting a malarrangement
but can you
of your
with
tooth.
This on?
So the catch is that you only take it out when you are eating.
Okay.
Yes, but after
what of when you are sleeping?
You can wear it whilst you are sleeping.
You won't swallow it?
No, you wouldn't swallow, because it's manufactured said that it's adapting exactly to the shape of your tooth.
Okay.
So it's individually customized.
Oh, so it's not
no, it's not a one cap fit, one size fit all.
Okay,
no.
okay.
It's individually customized. So once you wear it, if you have any malarrangement of your tooth, it could be used.
But this one, at least with the braces, I can see some wires, and I know
moving. Yes, so this is a proprietary material that also has a way of moving the tooth.
That's proprietary.
Okay, so proprietary, it means that they have developed it, the technology.
Okay.
They've developed the science behind the technology, so they owe it and they know how it operates, and it indeed works. I've seen a couple of patients who have worn it to correct some of their malarrangements.
And how long do you have to wear? So I know someone that has one of these clear aligners. It's called clear aligners.
Yes, Invisalign. Invisalign, invisible aligner.
I like clear aligners.
That one.
And she told me that she has to wear it for life.
Oh, okay. So that's a different thing. So that's probably a retainer.
Yeah. Oh, so they are different?
Yes, so they are different.
I'm learning a lot.
There are different appliances that you wear. Some of them which may be clear and may not necessarily be an aligner.
Okay.
So a retainer is for someone who has previously had a correction of their tooth done, and now the teeth has come into a stable position. So they need to wear the retainer to maintain the stable position that has been achieved. Otherwise, with time, the teeth might end up drifting back into the original position.
Why they've corrected you? Stay there.
Okay, so to add a little bit to what my brother has said, you see, dentistry has advanced. I mean, sometimes, so this is a message I'm sending to, those of us who are, a lot of people who have dental phobia, and then there are a lot of people who have some, misconception about dentistry that, we are still using our chisels and the hammers to do extractions, and everything is about, and it's scary. So dentistry has advanced. So can you imagine that, in the past years, for this correction, we're having these huge, prostheses or equipment to just correct malalignment like this. So, but dentistry has advanced to the extent that we have clear, instead of using braces, these wires, because braces, it consists of wires and brackets, and then it's quite mechanical. And then when you put it on, like when you have it's painful. And yes, it can be, especially when we start, and then it can even give you some bruises on your cheeks and all that. But we've advanced on them. So if braces, and the braces too can limit you with the food that you eat, because you cannot put on braces and then go and chew, kotodwe or something. You break it off. So it limits to the kind of food that you have. So technology has advanced, and then we've talked about it, and then right now we have
just chip in some of the questions that have come.
Okay.
And since we are almost running out of time, we'll quickly answer them. Someone says, they said if I take out my tooth, my head will become big. Is it true?
So I think that's what I was trying to.
Okay.
So there are a lot of misconceptions about
it's not true.
So yes, once it's done properly,
Jacob also says, please, what can I do to a hole in the teeth where food always accumulates? What can the person do about that?
So Jacob needs to see his dentist as soon as possible.
Yes, please, Mr.
And have
Jacob.
the tooth filled.
Okay. Please, is it good to clean the teeth with coconut oil sometimes? I mean, by adding it to your toothpaste.
Coconut oil and toothpaste. Because the toothpaste, the manufacturer, they've added all the things that you require. So you don't need any extra thing. It has everything.
I think it's now that the questions are coming. Yes. Someone says, please, what is the best solution to whitening yellow teeth? I think we've already spoken about it.
Yes, so either you do the whitening or you do the veneers.
And go and see your dentist.
Exactly, you need to see the dentist
properly
to have it done.
The veneers, there are types. There's a type that is, we have composites. That are quite, less.
Costly.
Yes, less costly. So when you are visiting your dentist, you should have options. So you should, as we are also giving education like this, you should also read and then get options before you go and see your dentist, so that together.
So please, doctors, my son is 2 years and he has a condition in the tongue called geographical tongue. Please, what causes that and how do I prevent it? Because it is on and off. Yes. I'm really confused.
So the geographical tongue is what we call migratory glossitis. So it's like a map. When you see the tongue, it's like as if we have Ghana map on the map on the tongue. So what it means is the person has lost, there are some papillae or some projections on the tongue that you use to taste. But because of some reasons, like vitamin deficiencies, allergies, and then other things, the person may lose such structures, and then it can be quite uncomfortable, especially when the person takes in spicy food, because you've lost it, and then the area exposed and then inflamed. So it can be worked on, just that the person can see the dentist and then get it managed. But just that most of the time we manage it symptomatically, and then we try and then get the, if the person has some, nutritional deficiencies, then we work on them, and then we can restore the person and to where, to normal, where, the person was initially.
Okay, so the person that asked the question about whether his head would become big when he removes the tooth is also asking if it is true that his tooth is connected to his heart. So if he goes for extraction, he can get heart disease.
Well. So the tooth is not directly connected to you can't pick a wire from the tooth that would link you directly to the heart. But there's some sort of connection between, as we've been saying all this while, that oral health is linked to the systemic or general health. Sometimes if you have a lot of bacteria in your mouth as a result of dental caries or plaque, and then you have some level of your immunity is suppressed or something of that sort, there's always a certain transient bacteremia when you are brushing. So meaning that when you brush your teeth, some of the bacteria in your mouth travel within your bloodstream. And normally if you are healthy, your white blood cells will pick out these bacteria and kill them off. But if you are not, your immunity is not too solid, then these bacteria could travel all the way back to the heart, because all blood goes back to the heart to be oxygenated and pumped back again. So probably by the time it gets back to the heart, it can cause some damage to the inner lining of the heart. So we can call it endocarditis as a result of transient bacteremia from the mouth. So that's the link.
So it's not direct,
no,
but then
there's
it
no
can
link.
happen.
Yes, it could happen. So it's not as if you have a badly broken down tooth and we need to take it off,
to go
it will affect your heart. And even for those people who have such conditions, we usually pre-medicate them. So we give them some antibiotics an hour before the procedure, and then after the procedure we give them adequate antibiotics so that it will prevent them having any issues of such nature.
Today I think we've spoken about a lot. We've all learned about pregnancy, children and their tooth health. We've learned a lot. So if you need anything, today I'm doing the conclusion for them. Go and see your dentist. Don't stay in the house and be adding coconut oil and charcoal and all those things to your toothpaste. You might be causing more harm than good. So I hope from last 3 weeks show to today's show, most of our questions have been answered. If you have any more questions, don't forget that you can always go see any oral health practitioner in our hospitals to help you. And do well to join us next week as we will be bringing you more interesting topics about your health. I've learned a lot, so I hope that you join us and subsequently you'd also learn a lot. Thank you for joining today's show. It's been a very good show. Have a good evening. Bye, everybody.
Bye-bye. Bye-bye.